Assalamu alaikum wa rahmatullah. My name is Mohamad Behairy. I am a second year medical student. Inshallah, within this hour, we will talk about everything you have to know with regards to the autonomic nervous system. Now, I think you have two lectures for this, one anatomy, one physiology. I did my best to combine them. Inshallah, everything you need to know for your final will be covered in this panel. So let's get started. طيب, أول شيء, let's talk about the nervous system. As we know, the nervous system is divided into the central and peripheral nervous system. The central nervous system includes the brain and the spinal cord, with the peripheral nervous system basically extends to the edges of the body. Now, the peripheral nervous system will further divide into somatic and autonomic nervous system. The somatic nervous system is responsible for all voluntary actions of the body, for example, skeletal muscle movements, while the autonomic nervous system is responsible for all of the actions that you do not control, things that happen involuntarily. We have three branches for this autonomic nervous system. We will focus on only two of them today, which are the sympathetic nervous system and the parasympathetic nervous system. The enteric nervous system, you will take it later, but it's basically a branch of the parasympathetic nervous system, but you do not have to worry about it for now. طيب. So as we just said, the autonomic nervous system regulates all of the involuntary activities done by the body. Unlike the somatic nervous system, it does not control any voluntary actions. Some of the functions of the autonomic nervous system would be regulation of your heart rate, blood pressure, digestion, basically anything that you do not control. Right. Now, when we talk about the sympathetic and parasympathetic system, it's nice to remember them as the accelerator and the brake of the car. Basically, even though the actions they produce are opposite to each other, they do not directly antagonize each other. They more of complement each other in a way, where basically you need the both of them to function, like how a car needs both the accelerator and the brake to function. So, the sympathetic nervous system, it is responsible for your fight or flight state. It is the accelerator of the car, where basically your body becomes more alert. It's like you're getting a boost so you can tackle a certain stressful situation. It's sympathetic, it sympathizes with you, so you're having all of these boosts. While the parasympathetic nervous system is responsible for the rest and digest state. The body is relaxed, you're not going through any stress, and that's when the parasympathetic nervous system is active. And as we just said, although they elicit opposite responses, they tend to complement each other rather than directly antagonize one another. طيب, let's go for a practice question. طبعا, since this session is recorded, sadly, you can just pause the video, try to answer it on your own. I will be reading the question and giving you the answer and explaining why, inshallah. So, the two main divisions of the autonomic nervous system are sympathetic and parasympathetic. What is the primary function of the parasympathetic nervous system? Now, before I answer, notice how I highlighted some words in red. I usually do this to convey a point, which is that throughout medical school and medical exams, like almost 75% of the question is useless. It's basically just words that are thrown to confuse you. Like, for example, in this question, we do not really care whether there are two main divisions of the autonomic nervous system and whatever. The only sentence that matters is primary function of the parasympathetic nervous system. And after reading that sentence, we can answer, where the answer would be C, the rest and digest response, which we just talked about. طيب. Now let's start building up on our knowledge slowly, until we get to where we want, inshallah. Now let's get into the preganglionic and postganglionic neurons. Tamam? I'm sure you guys heard these words a lot, especially in Dr. Vlad's lecture. I'm going to try to simplify them as much as I can, bidnillah. First of all, we have the spinal vertebrae. Well, now I'm not talking about sympathetic or parasympathetic systems specifically. I'm talking about both of them. Usually, the preganglionic neuron, the first preliminary neuron, will originate from the spinal cord. Tamam? So this neuron will be called preganglionic neuron. Pre, because it's before, and ganglionic, referring to a ganglion, like a nucleus, you could say. So the preganglionic neuron will make its way to the ganglion, whether it's sympathetic or parasympathetic. This will apply to both of them. After the neuron passes through the ganglion, it will be called postganglionic. Self-explanatory, postganglionic. Well, this postganglionic neuron will then make its way to the target organ where it can elicit a certain response, yani whether it's sympathetic or parasympathetic. So for now, I just want you to keep this in mind. We have a preganglionic neuron coming from the spinal cord. We have the ganglion, which is in between. And then we have the postganglionic neuron, which will then go to the target organ to elicit a response. طيب. So the route of a sympathetic neuron and a parasympathetic one start from the spinal vertebrae, as we said. وطبعا in some cases, the parasympathetic neuron will come from the cranial nerve. We will talk about that in depth later on. It travels then to the ganglion. Up to that stage, as we said, it's called preganglionic. After that, after it passes through the ganglion, we will refer to it as postganglionic. That's when it will go to the target organ. طيب. Now we're going to go into even more depth. We're going to take the sympathetic pathway, sympathetic neuronal pathway in itself, and then the parasympathetic one. They are very similar. It's just small differences between them and differences in namings. And this will be mainly about neurotransmitters and receptors. And for those of you who don't know what a neurotransmitter is, when a neuron wants to initiate a response, for example, in a certain organ, the neuron itself will not bind to the organ and cause the response. No, the neuron will release some of its contents that it has stored inside. These contents are called neurotransmitters. The neurotransmitters will then bind to the receptors that are found in the organ. Well, that's how the response happens. Let's take a look at this. First, we're going to talk about the sympathetic nervous system. Tamam? We start with the preganglionic neuron originating from the spinal vertebrae, and then it will reach the ganglion. But what is cholinergic R? Now, R stands for receptor. We're talking about a receptor that's called cholinergic receptor. Keep this in mind for now. We will explain what it is later on. After the preganglionic neuron releases neurotransmitters into the cholinergic receptor and finally passes through the ganglion, it will then move to the adrenergic receptor of a target organ. It might be confusing for now, just keep it at the back of your head for now. This is the sympathetic nervous system and how it goes on. Regarding the parasympathetic nervous system, we also start from a preganglionic neuron from the spinal cord, which reaches the ganglion, again with a cholinergic receptor. But the difference is when it reaches the target organ, the receptor it will, let's say, elicit its response to will be the cholinergic receptor once again. But now let's talk about the receptors. What is the difference between a cholinergic receptor and an adrenergic receptor? There are many differences, structural, many differences, but I only want you to know one single difference. This is the difference that you absolutely must know for your foundation final. That difference is that cholinergic receptors respond to only a certain type of neurotransmitter, which is called acetylcholine. So any organ, let's say with a cholinergic receptor, this receptor will only cause an action if it is stimulated by acetylcholine. On the other hand, an adrenergic receptor will be stimulated by only norepinephrine. Well, I think now it's a little bit more obvious as to why this is the sympathetic nervous system, with that one is the parasympathetic nervous system. With the sympathetic nervous system, the postganglionic neuron will release norepinephrine to the target organ. Norepinephrine, as you guys know, is adrenaline, which will cause the sympathetic activities such as increased heart rate, vasoconstriction, pupil dilation, basically preparing your body for a fight or flight response. But with regards to the parasympathetic nervous system, we do not want this norepinephrine. We do not want this fight or flight response. The body is at a relaxed state. So that is why the target organ will have a cholinergic receptor. So it will only respond to acetylcholine. Another difference I want you guys to know from this slide, we will get into detail with everything once again, but this is just like an orientation slide for you guys. The preganglionic neuron of the sympathetic nervous system is way shorter than the preganglionic neuron of a parasympathetic nervous system. Why is that? In all simplicity, in the parasympathetic nervous system, the ganglion is very close from the target organ. For the postganglionic neuron is very short, the distance between the ganglion and the target organ is very short, it's minimal. While in the sympathetic nervous system, The ganglion is closer to the spinal vertebrae. It's closer to the origin, but it is farther away from the organ. That is something that you should keep in your mind. طيب, let's go through this again for the people who like text. A neuron has to release certain contents in order to elicit a response. Well, these contents are called, as we said, neurotransmitters. Neurotransmitters will bind receptors to elicit responses. Well, as we said, certain neurotransmitters act on certain receptors. So cholinergic receptors will only respond to acetylcholine. Adrenergic receptors will respond to norepinephrine. طيب, now that we're done with all of the orientation, let's begin with the sympathetic nervous system in detail. So we have the spinal vertebrae, but you guys know that we have cervical vertebrae, thoracic, lumbar, sacral. Does the sympathetic nervous system exist in all of those vertebrae? The answer is no. It only exists in the spinal vertebrae from T1 to L2, from the first thoracic spinal vertebrae until the second lumbar vertebrae. Tamam? I want you to remember that for now. And obviously, the parasympathetic will have its own set of vertebrae, which we will talk about later. So, as we mentioned, the preganglionic neuron will first go to the cholinergic receptor of the ganglion. But here it doesn't say ganglion, it says sympathetic trunk. Sympathetic trunk is just another name for the ganglion of the sympathetic nervous system, because we can't call the ganglions of both sympathetic and parasympathetic system by the same name. But the ganglion of the sympathetic nervous system will go by sympathetic trunk. Tamam? It's basically the ganglion of the sympathetic nervous system. After that, the postganglionic neuron will keep going until it reaches the adrenergic receptor of a certain organ, and it will produce epinephrine so that we can have an effect. But what does IML mean? We said that the preganglionic sympathetic neurons are found in the vertebrae of T1 to L2, صح? Okay, but where in the vertebrae exactly do we find those sympathetic neurons? They can't be everywhere. I'm sure you guys already studied how sensory neurons are found in the dorsal root ganglia, in the dorsal horn of the spinal cord. This same concept applies here. The sympathetic neurons will be found in the lateral horns. Every certain type of neuron will be located in a certain area of the vertebrae. But in our case, the sympathetic neurons are found in the lateral horn, somewhere here. But where exactly in the lateral horn? In somewhere which we call IML, intermediolateral nucleus. The intermediolateral nucleus is found in the lateral horn of T1 to L2 vertebrae. It contains the preganglionic neurons of the sympathetic system. Let's go with the text. For the sympathetic system is also called thoracolumbar system. Why is that? Just a few minutes ago, seconds actually, we said in the sympathetic nervous system, the neurons are found from T1 to L2, صح? طيب, T1, T is thoracic, L2, L is lumbar. It is the thoracolumbar system. It is found in the thoracic and the lumbar vertebrae. Or as we said, the preganglionic cell bodies are located in the lateral horns of T1 to L2 vertebrae, specifically in the intermediolateral nucleus. You guys have to remember this. They ask a lot of questions about it. Oh, another piece of information that I would like you to remember is that preganglionic axons, they follow the same route as somatic motor neurons. But how can that be? Motor neurons originate in the ventral horn of the spinal vertebrae, while the sympathetic neurons are in the lateral horn. That is absolutely correct. But once they leave the spinal cord, they basically merge and leave within the same route, from the same route. That route is the ventral route, because the spinal cord, the vertebrae, basically has a ventral and a dorsal route. Both the motor neurons and the sympathetic neurons leave through the ventral routes. Well, this piece of info that I'm going to say is specific for the preganglionic axons. The preganglionic axons exit in white rami communicants. What are these things? In all simplicity, these are things that connect the vertebrae to the sympathetic trunk. We have a white one and a gray one, located in the sympathetic trunk with the vertebrae itself. The preganglionic axons will leave through the white rami communicants. while the postganglionic neurons will leave through the gray rami communicants. I just want you to remember this because it is pretty high yield. طيب, as we said in the previous slide, the postganglionic sympathetic ganglia, the ganglion of the sympathetic nervous system, is located in the sympathetic trunk. تمام? But this sympathetic trunk can be further divided. We have a paravertebral ganglia or a prevertebral ganglia. All you need to do is remember that the paravertebral ganglia is for the chest region, upper region of the body, with the prevertebral ganglia is for the abdomen and the pelvis, the lower part of the body. Tamam? Now we have one more important piece of info that you absolutely must know because we were asked about it in last year's foundation final. I still remember the question. And that information is that postganglionic sympathetic neurons always act on adrenergic receptors. That's what we already said, we have been saying for the past, I don't know, 10 minutes. But there is an exception. Receptors that are on sweat glands are cholinergic. Yani the sympathetic nervous system, whenever it wants to elicit a response, it will release neurotransmitters على adrenergic receptors. But there is one exception. Yani all of the organs in the body, when it comes to sympathetic innervation, will use adrenergic receptors except sweat glands. Sweat glands will have cholinergic receptors. But this is the only case where the sympathetic nervous system will release acetylcholine to the target organ on cholinergic receptors. The question that we got last year in the exam was like, which receptor does a sympathetic neuron release in sweat glands, something like that. But most students, the moment they read sympathetic, خلاص, they chose adrenergic. But they completely overlooked sweat glands, which is the only exception in the sympathetic nervous system which contains cholinergic receptors. So please keep that in mind. طيب, practice question. You guys can pause the video and try to answer it yourself. But the question goes, which neurotransmitter is primarily released at the synapse between postganglionic sympathetic neurons and the target organ? Let's go back here. Postganglionic sympathetic neuron, this one right here, and the target organ. What is it going to be? It's going to act on an adrenergic receptor, but the neurotransmitter that we need would be norepinephrine. طيب, I saw this slide in Dr. Abdul Jabbar's presentation. You guys don't need to go into much detail about these receptors. Yani you're going to take them later extensively. But for now, just to make sure you can answer the recall questions, it's good to remember a function or two for every single class of receptors. So first of all, the adrenergic receptors, and then an A, and we have B. A has two types, A1, A2. Will B has three types, B1, B2, B3. تمام? Any A receptor will cause vasoconstriction. For A1 و A2 كلهم vasoconstriction. Always vasoconstriction. B1, which is the one in between the A's and the other B's, will cause an increase in heart rate. تمام? So we have vasoconstriction, increased heart rate. Then we have B2, which basically goes exactly the opposite to the A alpha receptors, and that will be vasodilation, bronchodilation. Everything that has dilation is in the B2 receptors. B3 receptors will cause increased lipolysis, which is basically breakdown of fats. تمام? So we have A1, A2, vasoconstriction. B1, increased heart rate. B2, dilation of whatever. Or B3, increased lipolysis, which is basically breakdown of fats. But let's talk about the effects of epinephrine and norepinephrine. Once they bind to the adrenergic receptors, what changes are we going to see in the body? Keeping in mind, when epinephrine binds to an adrenergic receptor, it's like we're telling the body we are in a fight or flight response, or we need the body to adapt in a way that will support this cause. But we're going to divide this into two, carbohydrate metabolism and lipid metabolism. تمام? طبعا keep in mind, all of these mechanisms have one goal in the end, to provide energy for the body. If the body is in a fight or flight state, we need as much energy as we can to tackle the stressful situation that we're in. So the end goal will always be to produce energy. So let's start with carbohydrate metabolism. We're going to have an increase in glycogenolysis and gluconeogenesis. Let's break this down. Glycogenolysis. Glycogen, which is glycogen. What is glycogen? It is the storage form of glucose. And lysis, which means breakdown. So we are breaking down glycogen. We are breaking down the storage form of glucose. But why are we doing that? In all simplicity, because we want this glucose. We do not want to keep it stored. We want to use it as an energy fuel for the body. تمام? Gluconeogenesis, genesis means synthesis, formation, glucose. So we want to synthesize glucose. But it's pretty logical why these two pathways are being upregulated and increased. But glycogenesis will be decreased. Why is that? First of all, what is glycogenesis? Glycogen and genesis. We are synthesizing glycogen. We are synthesizing the storage form of glucose. We do not want that. Right now, the body is in stress. We want energy. We want glucose. It is not the time to store glucose. We want to use it. But that's why it's going to decrease. But that's with regards to carbohydrate metabolism. Now let's go to lipid metabolism. Only one thing will happen, an increased breakdown of TAGs, which are triacetylglycerides. Now, what are these things? They're basically molecules that contain free fatty acids in them, or fatty acids, let's say. Once we break them down, these fatty acids will be free in the blood, or they're actually a very good source of energy. So it's the same concept as glycogenolysis. We are breaking down the storage form of something to provide the body with energy. So these effects are very important. Please do remember them. Like another practice question. Which autonomic receptor mediates an increase in heart rate? The answer to this would be adrenergic B1 receptor. Now, the trick would be in this question is that there is adrenergic and cholinergic. Cholinergic has nothing to do with this. أصلا a cholinergic receptor would never increase the heart rate لأن cholinergic would respond to acetylcholine, which is a parasympathetic system mechanism, صح? Well, regarding the other options, we said A, anything that has A is going to be for vasoconstriction, or anything with B2 is going to be for vasodilation. Anything with dilation, bronchodilation, vasodilation would be B2. Or B1, the one in the middle, would cause an increase in heart rate. Right, let's move on to the adrenal gland. What is the adrenal gland, first of all? It is basically a gland that is found and attached to the kidney. On the top of each kidney, you have this adrenal gland. The adrenal gland is also called suprarenal gland. Why is that? Let's break down the words. Supra means above, and renal, the kidney. So it's a gland that is above the kidney. Tamam? Now, what is special about this gland? It's that it is pretty much considered a sympathetic organ. It has its own postganglionic sympathetic neurons. Or this gland releases epinephrine and norepinephrine to change the composition of the whole body and prepare it for a fight or flight mechanism. But it is safe to say that the adrenal gland is a special sympathetic ganglion, and it contains, as I just mentioned, modified postganglionic sympathetic neurons. Now, logically speaking, if the sympathetic nervous system wanted to stimulate the adrenal gland, would it need to pass through a ganglion and turn into postganglionic neurons? We don't need that. This organ already has postganglionic sympathetic neurons. Or this is why this organ, the adrenal gland or this gland, it is the only organ to receive innervation directly from preganglionic sympathetic neurons. Let's go back a little to make sure we understand this point clearly. We said that we have the preganglionic sympathetic neuron. It has to go through the sympathetic trunk, وبعدين it will go to the target organ as a postganglionic neuron. But in this case, the target organ already has postganglionic neurons. So we don't have to go through the sympathetic trunk. خلاص, the preganglionic neurons will immediately and directly go to the target organ. That is pretty much what I want you to know. طيب. Now let's move on to the parasympathetic nervous system. As we said, it is responsible for the rest and digest mechanism of the body when the body is relaxed, and it also has preganglionic and postganglionic neurons. Let's go through them in depth. We have the spinal cord, tamam. It gives us the preganglionic neuron. Well, as you guys can see, the preganglionic neuron is very long. لأنه the ganglion is very close to the target organ. I want you to keep this in mind. But this is completely the opposite with the sympathetic nervous system. طيب, we said in the ganglion in the sympathetic nervous system is called sympathetic trunk. طب بالparasympathetic nervous system, what is it called? It's going to be called terminal ganglion. Terminal usually means the end of something. But the way I remember the name is like terminal ganglia. We are at the end of the road. We are very close to the target organ. As we said, the parasympathetic nervous system, in both the ganglia and the target organs, it acts on the cholinergic receptors, which use acetylcholine. We don't want norepinephrine. We don't want to excite the body in any way. Relax. We want to keep it in this relaxed state. But this is not all. تمام? The vertebrae is not the only source of a preganglionic parasympathetic neuron. There is also the brain, not literally, but I'm more referring to the cranial nerves. We have four cranial nerves that give branches to preganglionic neurons that can elicit a response. For example, the vagus nerve. I'm sure you guys studied it already. Cranial nerve number 10. It is a major parasympathetic nerve which gives rise to preganglionic parasympathetic neurons that can go on to elicit responses in the body. تمام? Now let's get more specific. The parasympathetic nervous system is also called craniosacral. Why is that? Cranio, because cranial nerves, some of them at least, can give rise to preganglionic parasympathetic neurons. And sacral, because the vertebrae, the spinal vertebrae that contains preganglionic parasympathetic neurons are only three: S2, S3, and S4. All of them are sacral vertebrae. يعني احنا we said in the sympathetic nervous system we have thoracic vertebrae and lumbar vertebrae. In the parasympathetic nervous system, لا, it's only S2, S3, S4, sacral vertebrae. But that's why we call it craniosacral. And the cranial nerves that give rise to preganglionic neurons are 3, 7, 9, and 10. I want you guys to remember those, with 10 obviously being the most important one, which is the vagus nerve. Well, as we said, postganglionic parasympathetic neurons are located where? In the terminal ganglia, which is located very close to the target organs. That is why the postganglionic parasympathetic neurons are short, as we saw in this diagram. Right. One more piece of info which you could be asked about. It is not very important, but it could be asked in a recall format, which is that the sacral preganglionic parasympathetic neurons, the sacral ones, not the cranial ones, when they leave the spinal cord, they leave in pelvic splanchnic nerves, yani with them. Then we have something called a pelvic splanchnic nerve, but the sacral preganglionic parasympathetic neurons will leave with them. You guys remember how we said in the sympathetic neurons um, will leave in the same route as the motor neurons through the ventral routes. It's the same concept here. The sacral preganglionic parasympathetic neurons will leave with the pelvic splanchnic nerves. وبعدين they can synapse with the organ in the terminal ganglia. طيب, now we have a practice question. What is another name for the parasympathetic nervous system? I'm hoping this question is very easy. The answer would be craniosacral. Why? Cranial. We have four cranial nerves that contain preganglionic parasympathetic neurons, or sacral, S2, S3, and S4. طيب, let's move on to the concept of visceral sensations. Now, what does visceral mean? Visceral refers to internal, something that you cannot feel on the outside physically. It is visceral. It refers to the internal organs. Or sensations, anything you feel. That is why it's going to be afferent, not efferent. So visceral afferents that convey sensations other than pain, anything other than pain, they will accompany parasympathetic axons. Yani these sensory neurons that convey sensations that are not pain, they will go with the parasympathetic axons. تمام? Well, these sensations can be distension of the stomach, for example. Any sensation that you feel inside your body that is not pain. But what about the pain? The pain fibers, the sensory pain fibers, will accompany the sympathetic axons. You can remember this in a way that the body is sympathizing with your pain, but these pain fibers are accompanying sympathetic axons. Right, now let's move on to the concept of referred pain. What is referred pain? They are sensations that arise from the internal organs, for example, the liver, the stomach, the bladder. But where are they perceived? On the skin. Well, let me give you an example to further clarify this concept. Have you ever seen someone be like, my liver hurts? Or, for example, my gallbladder specifically hurts? La, you can never be sure. All they're going to complain of is abdominal pain, for example. That is close to the liver, which brings us to the second point. The pain is felt in the part of the skin that corresponds to the spinal segment of the organ that is causing the pain. So if I'm feeling pain in my liver, then this pain will be perceived and felt on the strip of the skin that is literally in the same spinal segment of the liver. But what do we call the skin? The strip of the skin that is in the same spinal segment of the liver, we call it a dermatome. But the dermatome is an area of the skin that is supplied by one sensory nerve root. So let's go over this again. An internal organ is causing pain. This pain will be perceived on a dermatome, on a strip of the skin, which is in the same spinal segment of this organ that is causing the pain. This pain is called referred pain. تمام? Referred pain is usually poor and local, not localized well. يعني, you can't be specific, as I mentioned. You can't be like, لا, my liver, this part of my liver is causing me pain. You can't know. All you're going to feel is pain in the area that of the skin that is next to the liver, for instance. تمام? طيب. Now let's move on to the clinical correlations from both the physiology and the anatomy lectures. First, we have pheochromocytoma. تمام? I like to divide this word into pheochromocytoma. Toma refers to cancer, or chromaffin cells. What are chromaffin cells? They are cells that release epinephrine and norepinephrine. But these cells, where are they found? In the organ that releases epinephrine and norepinephrine the most, which is the adrenal gland. So we have the adrenal gland. This gland contains cells that produce epinephrine and norepinephrine. We know this already. These cells are called chromaffin cells. But when these chromaffin cells experience abnormal growth or become way too much, we will have a cancer or tumor of the adrenal gland. But what is the effect or the side effect, let's say, of this tumor? We will have excessive secretion of epinephrine and norepinephrine. And this is obviously bad. Basically, the person will be in a state of stress, like always, constantly, which is not something we want, obviously. But that is the first clinical correlation that you guys want to remember, pheochromocytoma, which is simply tumor of the adrenal gland, which causes excessive secretion of epinephrine and norepinephrine. But the second syndrome, well, by the way, one point I would like to mention. Since this is a tumor of the adrenal gland, it is safe to assume that this is a disease that is related to the sympathetic nervous system, صح? Because we're talking about epinephrine and norepinephrine. So this doesn't really have to do anything with the parasympathetic nervous system. Because the diseases we're going to talk about, they're going to fall under either sympathetic disease or parasympathetic disease. This one is a sympathetic disease, تمام? The second sympathetic disease will be Horner's syndrome. Now, what is Horner's syndrome? It is basically a defect in the sympathetic neurons that are in the face region, that innervate the sweat glands and blood vessels. This defect could be caused by many factors. One of them is a lesion in these neurons. And for some reason, the neurons cannot elicit their effects. So if we have a defect in the sympathetic neurons in the face, we will have three consequent effects. First of all, inability to sweat. We talked about sweating and how it's an exception of the sympathetic nervous system. If the sympathetic nervous system is not working in the face, we're not going to have sweating in the face. This symptom, this phenomenon is called anhidrosis. Anhidrosis means inability to sweat. The second consequence will be drooping eyelids, as seen in this image here, and we refer to that as ptosis. تمام? Or the third mechanism is meiosis, or the third side effect is meiosis, and that refers to constricted pupils. تمام? We said in the sympathetic nervous system causes the body to be in a state of alertness, ready to tackle a stressful situation. صح? In this case, we will have increased heart rate, vasoconstriction, and dilated pupils. You want to see everything clearly and well. If the sympathetic nervous system is not working in our face, فمعناتها we won't have dilated pupils. The pupils will be constricted. That is called meiosis. Well, here you can see يعني, in the picture. Let me remove this. طبعا this condition doesn't have to affect both eyes or both sides of the face. يعني in this case, it is unilateral. This eye is not affected, while this one is. Or in other cases, both of them can be affected. يعني. Well, the same thing applies to the first disease we talked about, which is pheochromocytoma. It can be unilateral or bilateral. يعني either one gland, one adrenal gland, or both of them. In most cases, it only affects one, but it's unilateral most of the times. طيب. With regards to Horner syndrome, I want you guys to remember that it is a sympathetic defect that affects the face. It causes three things: anhidrosis, inability to sweat; ptosis, drooping eyelids; and meiosis, constricted pupils. طيب. Now let's move on to the one and only parasympathetic disease or defect that we're going to talk about today. And that is called aganglionic megacolon. تمام؟ طب let's break down the word. Aganglionic. A and ganglionic. In medicine, if we have a word that is followed by or before it, yani we have A, it means we don't have that thing. Aganglionic means there isn't a ganglion. تمام? For aganglionic megacolon, it is the colon, part of the digestive tract, large intestine to be specific. We don't have a ganglion. تمام? Let's say like that for now. More specifically, this disease is a defect in the neural crest cells which cause the absence of the terminal ganglia. Yani these neural crest cells, normally speaking, they're going to form the terminal ganglia that are found in the large intestine. عشان whenever we have parasympathetic innervation, it's going to go to the terminal ganglia that is specific to the large intestine and cause a response. When we have a defect in these neural crest cells, we're going to have the complete absence of these terminal ganglia. Yani whenever a preganglionic parasympathetic neuron wants to stimulate a response, wants to release its acetylcholine, there isn't a terminal ganglia. Basically, there won't be an effect أبدا. There won't be a response. Nothing will happen. But what is the consequence of this? More the parasympathetic system is rest and digest. It helps with digestion. In all simplicity, if we have a defect in the parasympathetic nervous system, if we don't have a terminal ganglia, we will have impaired digestion, in all simplicity. Or more specifically, this defect will lead to an absence of peristalsis. Or peristalsis, as you guys might know, it's basically the contractions that cause the food to move throughout the large intestine. But if we don't have peristalsis, the whole process of digestion will be impaired. These are the three diseases that I want you guys to have a good idea about. Lina, you might be asked about them, especially Horner syndrome. But one more practice question. Which of the following diseases is characterized by lesions in the preganglionic and postganglionic sympathetic neurons of the face? طبعا, if you guys noticed, most of this question literally pointless. Yani, all we want to know is disease, sympathetic neuron of the face. But the disease automatically has to be sympathetic, صح? It is not aganglionic megacolon. Hyperthyroidism, you guys didn't take it, it's not related. Pronator syndrome, نفس الكلام. The two options that could work are pheochromocytoma and Horner syndrome. They're the only two diseases that are sympathetic. بعدين here they said neurons of the face. We're talking about the face. Pheochromocytoma is cancer of the adrenal gland. It cannot be the answer. The only answer that is left, which is the correct one, will be Horner syndrome. Well, that is pretty much it for the lecture. But before we wrap up, I want to tell you guys with regards to Dr. Vlad's lectures, these practice tests that he puts at the end of every lecture, these are very important in a sense that in the final exam or in any exam, all of the questions that he will include are very similar to the ones in this practice test. Sometimes, wallah, I remember in 2 or 3 occasions, the same exact question was copied and pasted from the practice test onto the final exam. If not the same exact, then it will be very similar, a very similar concept. Well, I tried to have the questions of this lecture in this style, but what I'm trying to say is if you do the practice questions and tests of Dr. Vlad's lectures, or you do well in them, that is a very good marker. And mashallah, alhamdulillah, you guys grasp the concepts of the lecture in the way you're supposed to. Other than that, you guys have almost a week, less than a week till your foundation final. I wish you nothing but the best. It is a tough challenge, definitely, but you guys got this. As long as you study, work hard, and dedicate yourselves to the cause, inshallah, you guys will pass with flying colors and with the grades that you want, inshallah. It is very doable. Do not listen to any negative stigma or comments that surround the foundation final. You guys got this. It is just like any other test. Focus, study hard, وإن شاء الله you guys will do great. ويعطيكم ألف عافية. Thank you guys.